Welcome to The Bridge, the show that bridges the gap between Eastern and Western medicine, science and spirituality, physical and energetic health. If you're seeking to heal from within, ultimately achieving the pinnacle of health and well-being for your mind, body, and spirit, then rest assured, this show is tailored just for you. I'm Dr. Elizabeth Rogers. I'm a heart-centered, Harvard-trained epidemiologist, researcher, medical intuitive, and transformational health and longevity doctor. Basically, I find the clues that every other health practitioner misses because they're looking in the wrong place. Welcome back to The Bridge, a transformational health podcast with me, Dr. Elizabeth Rogers. Hi, podcast family. Welcome back to the show. Thank you for being here with me. I am really happy, as always, to be here connecting with you. And speaking of connection, I hope as you're tuning in today that you're feeling connected to yourself, connected mind, body, and spirit, and connected to your source. And you'll continue to hear me say this into infinity. That connection is the very essence and foundation of being optimally healthy and well. And I also hope as you're tuning in today that you're feeling excited and inspired and pumped up and fired up. And if you're not, then I hope that you are by the end of today's show, because I am coming to you feeling very pumped up, fired up, inspired, passionate, and enthusiastic. Those last two qualities just run in through my veins, in through my soul, through my spirit. It's like part of the essence of not just my physical being, but my non-physical being and my energy. It's probably why my kindergarten teacher put me in timeout for being too happy. Yes, that's a true story. And yes, I'll tell you the whole story. We'll talk about that on another day. But I've always been very passionate and enthusiastic in general. And throughout my lifetime, I've grown increasingly passionate and enthusiastic about the topics of health and healthcare. That's what we're going to talk about today. I'm sure, as you know, we have a very flawed, corrupt, and broken traditional Western healthcare system. And what are we going to do about that, right? We can't just implode the system. But there are things that we can do to help to facilitate change. And one of the things that we all have in common here isn't just that we've all had negative experiences navigating the Western healthcare system. It's that we've all had some parallel experiences in the ways in which we've had those negative experiences. Now, one of the most common things that we all can commiserate about, I'm sure, is the length of time that we spend making doctor's appointments, waiting for doctor's appointments, particularly waiting for doctor's appointments. And it's the waiting that I want to talk with you about on today's episode. And I'm going to share a very personal and real story that happened to me recently that inspired this specific episode. And so before we do, I wanted to do a little research for all of us on wait times in doctor's offices. A recent study conducted in 2024 showed that people wait for, on average, 15 to 30 minutes to see a physician. Now, that may not sound so long. However, it is. And I'd also love to know more about the sample of people that they surveyed, because 15 to 30 minutes doesn't sound so bad compared with the wait times that I and a lot of people I know have experienced and are currently continuing to experience. Now, this study also showed that waiting outlasts everything else at a doctor's appointment, including seeing the doctor. Over half, as in 62.7% of the respondents of this study, indicate that sitting in the waiting room specifically is the most time-consuming part of visiting the doctor. Did anyone hear what I just said? Waiting outlasts everything else at a doctor's appointment, including seeing the doctor. people are indicating that sitting in the waiting room at the doctor's office is the most time-consuming part of visiting the doctor. I don't care what kind of practitioner you're seeing, and I don't care whether they're a part of the mainstream system or not. The longest part of visiting any kind of doctor or health-related practitioner should, no brainer, be the time you spend with the doctor. The most time-consuming part of visiting the doctor should be visiting the doctor. However, we are not anywhere near that type of a model or that type of a system anymore. And to me, what I just said is highlighting a massive, massive problem. In fact, wait times can be up to or more than triple the time that we spend with the doctors. So wait times are now the most significant part of visiting any type of doctor or practitioner. Now, why is this? Of course, when I did some research and looked up articles, you can find any type of excuse in the book. One of them being there aren't enough primary care physicians. Why? Why aren't there enough? Well, more and more of them are approaching retirement age. Fewer medical school students are selecting primary care as their specialty for a number of reasons, in addition to the salary. And the traditional primary care model is reliant on health insurance reimbursements for their revenue. Therefore, the model is broken. And I've also read that doctors have too many patients. Well, then put a limit on the number of patients you're willing to see if you have too many. Now, I know if you are a physician inside the mainstream system, I know that it is not just that easy, that you must play by their rules. However, clearly we have a system here that is not set up to support all of us, our best interest, and our optimal health and well-being. And so I want to talk about this with you today. And I want you to consider these two questions. When is enough enough? And have you had enough? Because I have to tell you, I personally have had enough. And the only way that we can make change is by going first. Leaders go first. And so today I'm going to share a story with you about something that just happened to me quite recently. And then I'm going to tell you that I'm going to go first. And I'm going to invite you to come along with me. If you've been listening to this show for any length of time, most especially these last few months, then you know that during this calendar year of 2024, I have been navigating and am continuing to navigate some very serious health challenges as a result of some very poor quality care that I received at a dentist office back in January. If you don't know what I'm talking about, then I strongly recommend you go back, fill yourself in, get the context, listen to those episodes, and then come back here to join us. But because you know that and you have that context, then you know that I am currently seeing several mainstream specialists as I navigate this challenging situation and continue to move myself back to complete and total optimal health and well-being. Now, one of the practitioners I'm seeing is a neurologist, as you know, if you've been listening to the show. And I recently had a follow-up visit with my neurologist. And that is the story I want to tell you about. And it has nothing to do with my visit to the neurologist. It has to do with what happened inside that waiting room. So my husband and I recently went to see my neurologist for my first post-op follow-up visit. And we walk into the waiting room. And if any of you have ever been to any mainstream doctor's office, then you know the drill. And you can probably picture exactly the scene that I walked into, which is we open the door and they have got that room jam-packed like sardines with people. I don't even know if there are any empty chairs in the room. I'm feeling a little overwhelmed immediately when I walk in because I see all these people. My eyes get big and I just think, oh gosh, we're in for a long wait. And so I go up to the counter, sign in for my visit. They give me the usual paperwork to fill out. I sit there and I fill out my paperwork with my husband, and then I finish. And then I proceed to just and sit in quiet observation, something I tend to do. I'm an epidemiologist, so I'm just this non-judgmental little observer fly on the wall. And I just sit and thoughtfully get present and watch. And I'm watching the scene around me, and there's people fidgeting in their chairs. Some are just zoned out in books or staring at the TV up on the wall. Lots of people zoned into their phones, just doing anything to keep themselves occupied. And every time the door opens and someone comes out to call the name of the next patient, everybody stops, right? And you know what everybody's thinking? Oh, I hope I'm next. And you see that sigh of relief and that shift in the person's energy when they're the one whose name gets called. And I always think it's funny because we get so excited when they call our name, but all they're really doing is taking us back to another room to wait some more. So I get all excited and I think, oh, I don't have to wait in this big room with all the people. Now I get to go wait in a different room that's smaller by myself, usually, or, whatever the situation is at the particular practitioner's office that you are attending. So, we're sitting there and we're sitting there and we're sitting there. And I have the registration desk to the back of me. And I see out of the corner of my eye a woman and two other people with her walk up to the counter. And so it draws my attention. And the woman who leads knocks on the window and they slide the glass back. And then I proceed to hear this woman say, "Hi, I brought my parents here today to see a new doctor, and we've been waiting for over 30 minutes. So we'll be leaving now because that's not good enough for us. And we'll be going and finding a different doctor where we won't need to wait as long." And they just walked right on out the door. And I'm looking around the room and I'm thinking, where is everybody going to start getting up and cheering? Because I wanted to. So I did. And right in front of everybody in the waiting room, I probably took everybody's attention away from what they were doing. I might have scared a few people or startled them. But sitting next to me is my husband. He knows what I'm thinking. I get really excited and I just start clapping. And I just, in front of the entire room, I said, "That is absolutely right. Good for them. Good for them." And I looked at my husband and he knows I'm all fired up. And I said, "Good for them." I said, "You know what? That's exactly what we all should be doing. We all need to be getting up in this room and going up to those windows and saying, this isn't good enough. It's not good enough for us anymore. We're done. We're done waiting. We've been waiting lifetimes to see the doctors. And you know what? This isn't good enough. And we demand better. So we're walking out the door." I mean, what I watched that woman do in that moment empowered me in a way I haven't felt empowered in quite some time. And it also made me feel disappointed in myself because I thought, here I am always getting passionate about this stuff, wanting to see change, wanting to help facilitate change, wanting to help lead change. And I've never even done what this woman just did. I've never gotten up and just said, "I'm frustrated. We're waiting too long to see the doctors. This isn't okay. This approach, this way, this system, it's not okay. I will not participate. This is not good enough. It's not good enough for me. It's not good enough for my family. It's not good enough for my loved ones. It's not good enough for any of us. It's not good enough for all of us." And the more of us that start doing this, believe me when I say, the ripple effect will grow and we will eventually force a change. But if we're all going to sit around and wait for the healthcare system to magically get better on its own, I'm here to tell you all, it's not going to happen. Now is our time. We're the ones. If we want change, if we want this system to be better, not just for us, not just for our children, but for the future, then we must lead the change. So this is my call today to hopefully inspire all of you, because I am wholeheartedly and completely and permanently inspired. I wish I knew this woman. I wish I would have ran out after her into the hallway and said, "You are superwoman, and thank you. Thank you. Thank you for leading by example." That's empowering. That got me so excited. So I hope that this woman's inspired you the way she's inspired me today. And now I want you to ask yourself, the next time you're sitting in a doctor's office and you find yourself waiting, I want you to think of this moment. And I want you to ask yourself, have I had enough? Is this good enough? How much do they value me and my optimal health and well-being if they just expect me to accept that I will sit out here for as long as they want until it's my turn? We have to make change. And I don't know about you, but this is my promise to all of you, to spirit, to the universe, right here, right now, in this moment, that the next time I find myself in a situation like that, I will use my voice. I will get up and I will say something. I will go up to the window and I will tell them, this isn't good enough. It's not good enough for me. If I'm there as an advocate for a loved one, I will tell them, this is not good enough for my loved one. You need to do better. We will go find another doctor who is already doing better. I feel like I need to get a t-shirt that literally just says do better on it and start wearing it all over the world, because there are just a lot of examples, everyone, of how we can do better. And I'm sure I know I can do better too. So feel free to point it out to me, but just know I am a reflector and I'm always reflecting on how I can be better and how I can do better for all of you, for all of us, for the whole world. And are you tired of waiting? Because I know I am. I can quite literally think of examples of times when I was in doctor's offices. I'm thinking back to when I was in my 20s and I had to have foot surgery. And we would make a doctor's appointment to see the foot surgeon for 9 o'clock in the morning, knowing it was at the early part of his day. We would get there for that appointment and they would already tell me, just so you know, he's already behind 2 hours. Sometimes I sat in that waiting room over 2 hours just to see the surgeon. And I bet, in fact, I know that you all have stories like this too. I know you specifically listening, you have a story like this. And that is why we need to use our voices. You're not the only one going through this out there. I'm not the only one. It's all of us. And this is how the system treats all of us. I don't know about you, but that's not a system that makes me feel valued. And it's time for us to create systems that put us first, that value us first, that serve and support us first. We have to lead the change. And I want to hear your stories. So next time you go out and you take a stand and you speak up or advocate for yourself or someone you love inside of any type of health practitioner setting, please reach out and tell me about the story, because I want to share it. And this, my sweet podcast family, who I love and adore, is why we also need research around this topic. So I've mentioned this just once before, but I want you to continue to stay tuned, because my team and I will be launching a research study soon, as in sometime later this year. And I'll keep you posted as we're trucking along. But we will be launching a research study I want to invite all of you to participate in, because it's time for us to share our stories. It's time for your voices to be heard. And it is way long overdue that some brilliant research scientist and doctor has decided that it's time to take a closer look at and really study how the experiences we've been having inside of these places have affected and are affecting our optimal health and well-being. Because I can tell you right now that they are. So let's go show the world and let's prove it. And when I have this study ready for you to participate in, you'll be the first to know here. But stay tuned because it's coming. And in the meantime, get fired up. Next time you're out there and you're sitting there and you're just waiting and you're pissed off, get up and say something. Don't wait. Take action. And I know that I haven't always done that either, but now I promise I will. So I hope today we can all promise each other to follow through and take action and rise up and use our voices together because we are the ones. We're the ones who are going to make the change that we want to see in the world. So let's stop waiting and let's start taking action and speaking up. I love you all so much. I hope that you're feeling a little more fired up and inspired than you were at the beginning of the show. And if you see something or experience something, then say something and tell us your story so I can share them here so we can all keep helping each other stay inspired. I have lots of good stuff coming up for you on our next few episodes. In our next episode, I'm going to tell you a story about a pasta guy. So that's all I'm going to say for now. I hope that I leave you today feeling even better than when you came. And remember, the journey to create and sustain optimal health and longevity is always an ongoing one. So until next time, stay inspired, stay aligned, stay connected, and go use your voices. Thank you so much for listening to The Bridge, a transformational health podcast with yours truly, Dr. Elizabeth Rogers. If you enjoyed the show today, it would mean so very much to me if you subscribe to the show and leave an honest, positive review. You can easily subscribe by going to the upper right-hand corner of Apple Podcasts, Spotify, Odyssey, or wherever you listen to podcasts and press the plus sign in the upper right-hand corner. Also, be sure to sign up for my email list and join our private community to get even more content, value, and support on your health and well-being journey. You'll find these links in the show notes. Sending you so much positive and supportive energy today. I really hope you can feel it.